Assalamu alaikum. Welcome you all to today's discussion. This is me, Saeed Ahmed from Special Child Care, and we have with us from London, Dr. Christos Nikopoulos. And Dr. Christos, I would like to welcome you to Special Child Care once again.
Thank you very much for the invitation.
You are
Thank you.
welcome, and thank you very much for giving time for the second episode, as you did one before with us. And everybody knows about Dr. Christos. Dr. Christos is the director of Autism Consultancy Services in London. He's a consultant of ABA, that is Applied Behavior Analysis, and he's also a PhD in the same field. So, I mean, he's an educationalist, he's a practitioner and academician, and we are very, very happy to have him today. So today is the question answer session, and we launched it in our group and asked questions from the parents. And I have got some questions from the parents. So I'd like to start with those questions and wait for parents to come so we can have other questions from them. So one questions, which coming like, recurrently actually, from different parents, that when the child goes outside and when they return home, first of all, they don't like to return home, first of all. And secondly, when they return home, they create a lot of chaos at home. Like, even banging their home, hitting people, hitting himself, right? So it takes even like, 10, 15 minutes to, calm him down. So any tips for that? I mean, why they do it? We don't like to come back home.
Yeah. First of all, something that I need to clarify is that there is not any intention to give tips, because it doesn't work like giving tips. Any situation and any individual has to be treated individually. So from that reason, when that happens, when let's say a child escapes and runs away from home, there are a few things which need to be investigated and to find more information. First of all, why that happens, what the child does at home at that moment, and then he runs away in order to escape. Was it a demand? Was it something difficult? This is the first thing. Then when the child goes out, it needs to be investigated, and what exactly he or she does outside. So that means that was the motivation of the child to get out and to run away from home to find something more interesting outside, or to play outside, or left something in the middle outside, and so on. So when these two variables have been found before the behavior and after the behavior, then it will be easier to identify why the function, why that happens, and accordingly to be able to make a function-based intervention.
Exactly. So you mean like, for example, two children do the same thing, but they may have different reasons,
Yes,
and
exactly.
the management protocol will also be different.
Exactly. So
So
for different reasons, we can have completely different behaviors, and this is the reason that it's not appropriate to provide tips, because for one reason that suggestion might work, for another child might not work at all. So it is not ethically to say that, okay, this intervention or this approach will fit all, will work for any child. So it is exactly as you said it. You need to investigate the reasons and what it happens just before. I'm not saying hours and days. It might be that, okay, the child, let's say, came from school and the child had a lot of fun outside playing with his or her friends. And it might be that the reason that, okay, getting in the house, then wanted to go out again. So all this needs to be investigated, and accordingly, a function-based intervention to be applied.
right. So you mean that when they come home, maybe they miss something outside. They don't like
Yes,
to go back. Something more
yes,
funny, more interesting. Okay. And so
yes,
as parents, we need to observe his behavior before
yes.
and after, and also in outside what they do outside. Okay. Thank you very much. Another question, which is very close to this question, another parent asked that, her child, her son, behaves to her, in her language, he behaves like kind of weird behavior, does the weird behavior only in public, but at home, he's fine.
Right. When okay, this weird behavior, whatever that weird behavior is, we need to first of all to clarify that any behavior that anyone does, that behavior is emitted because there is a reinforcement. So there is something that the person who emits this behavior gains out of this. Now, as in the previous example, the person, let's say hypothetically, will want to gain the play with a peers or anything. Now, in public, when this weird behavior happens, what the parents need to investigate is again what it happens just before and what it happens afterwards. If it is the attention, for example, it might be one of the reasons seeking attention behavior. So you are outside, you are doing something weird, then your parents tell you, even if they tell you to stop in a nice way, this can be attention. So they tell you, oh, no, this is not right to do it here. And then possibly the reaction from other people in the environment and so on. And that will be something that uh, functions or is the main reason that the child engages in that behavior, possibly. Now, how this can be treated, if it is, and that is related to the previous one, when the function is identified, when it is, for example, okay, to gain attention or to gain something else, then the first thing is that the parents or someone tries to build or to teach an alternative behavior, a more appropriate behavior. Instead of doing and engaging in all of these weird behaviors to say, okay, mom or dad, or let's do this. They try to teach, they try to give attention to the child. Many times it happens, particularly when families take children outside for shopping, for example, okay, to not to pay that much attention to the children because they are concentrated on the shopping, what they are going to buy, to ask information, to pay, to try if it is closed, and so on. So at this time, the child, instead of being able to say, mommy this or my daddy this, then they find that weird behaviors to get the attention, and that serves the purpose for them. So instead of doing this, it's better if they try to have the children part of the shopping, to ask the children, oh, can you pick up this for me? Can you put it in the basket? Do you like this? So to have constant attention in case that it is attention the problem.
Okay, so okay, right. So I mean, communicating with sometimes you see that we go to shopping and we ignore our child. So that might be
Yeah.
another reason that he wants like attention. That's why he does all these things.
It is quite common to happen this. It's quite common. I'm not saying that it is for everyone, but it's quite common to happen in that way.
Right. Okay. Thank you so much. Another thing coming about the use of bathroom. One mother, she asked this question. Her son, I mean, and some other parents also, like the child. Uh,
I didn't hear the question.
I mean,
Can you repeat?
the child fears to go to bathroom, right? Use the
Mhm.
bathroom. I mean, he go to bathroom, and after that, he sits over there and he looks at some particular place, and I mean, gets afraid. I mean, as if he has seen something like dangerous, but nothing is over there. Nothing is over there, right? And he doesn't like to even see, doesn't like to even finish his, I mean, toilet, and I like to come up, right? I mean, come back. We need to push him to the bathroom, but we check, I mean, they check like carefully, nothing is there, no problem is there, light is sufficient, everything is there. And she said, the mom said, like the first time of the day he doesn't do any problem, but after that, that's from second time, he's like doing like very, even they need to push him to a bathroom.
Right. So the very first time, now we are talking about the children going themselves, or they are reminded by the parents, okay, do you want to go to the bathroom? Do you want to go to the toilet? If it is not an independent performance, it is quite likely that during the process of teaching the bathroom, teaching how to use the bathroom, something was aversive, something happened and the children didn't like. So there is that association of not a very, very good experience. It can happen quite a lot when there is a persistence, when the child grows, let's say becomes 3, 4, 5 years old, then this problem has not been solved, and obviously understandably parents, there are times when they can become a little bit more frustrated, more pushy, in order for this behavior to happen, and all this training doesn't happen in a very, very calm way, because they have tried numerous different ways of teaching the child. All of these are understandable, and they are quite common to happen. So during that process, if anything was not nice for the child, then there is that association between the bathroom and that bad experience. It doesn't mean that that happened many, many times. It can happen 1 or 2 or 3 times. That can be one reason. Another reason can be if there is any issues with constipation. This is quite constipation. This is quite common,
I,
and the
I,
whole
I asked this question and she said no, it's nothing to do with constipation. But as you said, the
yeah,
first point, that if he had something on his mind, some bad experience, I mean, on his
yes.
mind, which is like kind of like, solid on his brain, what can they do to kind of make him forget that thing? Is there anything they can do?
Yes, of course you can do. If we hypothesize that it's different, it's difficult to use a different bathroom just to erase this bad memory at the beginning. Uh, the efforts need to be made to make all this bathroom experience something very, very, very pleasant. If the child goes the very first time, then the parent can go after, when the child has finished, and then provide a reinforcement. Well done, this is amazing, you did a great job here. It can be even to give something, a small sweet or something, trying to associate with a very, 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 very nice experience. And also during the day they can go there, not only for this, let's say only for the environment. They can go there, let's say during the bath. They can make it a very, very pleasant experience. They can play with some toys, with anything. So in a way to make the whole experience, the whole environment, something very, very pleasant. So they can grasp as many opportunities for this. Uh, if they can take this gradually, this, let's say, if it happened in the past, bad experience will be erased, will finish.
Okay, okay. So just to make him, just okay, okay. Let him know that the using bathroom is not a, any like fearful thing. Rather this is interesting. This is pleasant, and we are with you. I mean, this kind of reinforcement. Okay.
Yes,
Thank you so
yes,
much. I mean, the last question that I have got, like, one parent. I mean, she asked me. I mean, his son like keeps jumping when he's free, but when he's occupied he doesn't jump. But when he's free, I mean, between the tasks or something, he keeps like jumping. Now, I think this is quite normal, but what is your point of view?
yeah. It is quite normal within the spectrum. Of course, we try to eliminate what for any behavior, inappropriate behavior, in order to decrease its frequency. So, for example, now the jumping up and down, new behaviors more appropriate, and of course, independent play. So the ability of the child to engage with toys without having someone all the time next to the child to play with. Now, the more activities, this kind of activities are introduced within the child's repertoire, the better. But the thing is this, that these activities, one common mistake that happens from most parents, let's say that for practical reasons, including myself, because I am also a parent, is that when we see our children play with something or do something nice, and this is the time when we say, okay, let's finish that email, let's do this, let's cook a little bit. So it's our time to do all the other things at home, and now when we work from home at the same time. Now, When that happens, unfortunately, the children do not get as much attention and as much help in order to continue to play with what they are playing or the attention that they are doing good things. So it is vital that we remember, although that, okay, we need to do some work periodically, every few minutes, just to give attention. Oh, what you're doing there. Oh, that's very, very good. Oh, excellent puzzle. Yes, come here, sit next to me. And just to give our presence as much as possible. If that happens, these jumping behaviors will not happen that often, because the child wants to gain pleasure. The up and down behavior gives any sort of pleasure, and that's why they are doing this, because it's something that's it's fun for them. Now they can have other activities to get fun from, and this will be even more reinforced and highlighted when the parent gives attention as much as possible. It doesn't have to be next to the child, even a couple of words here and there, and what you are doing, show me what you drew now, that will be enough. Because this is what it happens for obvious reasons, for practical reasons. When the children are doing something nice, we don't give attention.
Thank you so much. Actually, this is a very common question. Many parents come up with these things that, you know, that most of the children, I think, I mean, on this spectrum, is this spectrum, they have like this kind of hyper, activity. Well, I mean, this
Yeah.
is the questions I had. Now I'll go to the parents, ask them the question, and I may speak Bengali sometimes. I'm sorry for that.
Yes.
যারা আছেন কারো কোনো প্রশ্ন আছে, প্রশ্ন করতে পারেন ইংরেজি বা বাংলাতে। বাংলা বললে আমি ওনাকে ইংরেজিতে করে দিব। আমাদের সময় খুব কম, ওনার টোটাল সময় হচ্ছে 1 ঘন্টা, তার মধ্যে আর সময় আছে 35 মিনিটস। প্রশ্ন করেন প্লিজ।
Saeed bhai, thank you very much for arranging such a nice meeting. And
আমি একটু সরি, আই এম সরি, একটু বাংলাতেই বলি। আপনি আজকে ইন্ট্রোডাকশন দিয়ে না, আমাদের সময় খুব কম, প্লিজ প্রশ্নটা করেন।
Okay. Thank you very much, Mr. Christos, for coming back to us once again. And my question is that my child wants to go to outside or go to the playground every afternoon, but he never shows any interest either in playing or watching the play. He rather keeps on walking with me all the time. My question is to you, how I can effectively use 1 hour time every day to develop my child's play skill, peer relation, or communication and social skill. I want to actually effectively use the 1 hour time which I am spending each and every day, every afternoon.
Right. When you go outside with your son, you mean?
In the playground, in the afternoon. Playground.
Afternoon.
Yes.
Afternoon.
In the afternoon. Now, what the first thing that you can do is this: try to put down, let's say, on a piece of paper, what are the skills that your son can do? Anything. Let's say, as a kind of my son can do name colors. I don't know, throwing a ball, anything that your son can do. Put them down, and then when you go out, you will start from there. You will know that, okay, at the playground, my son knows to identify the colors, or even to say the colors, or even to throw a ball, or to use the swing. And then from there, try to use this as a learning opportunities. Try to talk, to speak to your son, and then your son will be able, as long as these are skills that he can do, he will respond to you. And then from there, gradually, try to build some more skills. For example, let's say that he likes throwing the ball. Okay, he likes throwing the ball. You're holding the ball. You're going close to him. Instead of throwing the ball, try to teach your son to say, okay, give me ball, or play, depending on what his verbal skills are. So in that way, let's say, to create some sort of a little bit one step of difficulty, but however within the skills of your son, and then you will take it from there, and gradually you will build communication. You will build communication first of all with you, and then gradually with the other children. If there are other children in the park, in the playground, then it is essential that you will try to guide the attention of your son to imitate other children, to see what another boy, another girl are doing. Try to do the same. Try to prompt your child, or to remind your child, look here, look there. This is the way that it comes more natural. And then any sort of difference, you will know from the piece of the paper all of the skills, and then you will be able to identify whether something new happened during that experience, during that afternoon that you went out, and then you will start building from there.
Okay, thank you. So what I actually do, that in my home, I try to play with him, because it is not all the time possible for me to play with my child in the playground, because it's a big place and there are lots of children are playing there. Sometimes it becomes very much difficult for me to practice this sort of playing with my child. Then he keeps on working with me indifferently. He has no interest. He shows no interest in anything. Watching the children's play, or never try to show any interest in other activities, in any other activities.
At home, does your son play with anything? What does he do? Let's
Actually,
say
he has no interest in play, or his play skill is not very much developed, or he never shows any interest to play. I'm trying gradually to make him interested in play.
So what does your son do when he's, let's say, at the weekend, when he doesn't have to go to a school, and he spends many hours at home? What does he do?
He likes drawing.
Yes.
And sometimes he drawing and painting.
Anything else?
Actually, and nowadays, actually, he is most of his skills are deteriorating. That's why he's reading in a normal school in class 5. But my concern is that nowadays he becomes very indifferent to everything, and he becomes very cool and calm, and he talks very little than before. And he has actually loses his intentions or interest in any other activities. That's why I think he is not showing an interest in play or anything else.
So your son is, I believe, 9, 10 years old?
13 years old.
Sorry?
13 years old.
13 years old, and he goes year 5. Okay, so he missed a couple of years. Or unless in Bangladesh, children go older to school.
Sorry, I don't get your question.
6 years. 6 years old.
6 years old. Okay, so Latifa, you said that you have seen some sort of regression. So your son has lost some of the skills. Have you noticed this in all areas? Because of there are times when we say that the child loses skills, that means that they may stop doing a few things, but they may start doing other things instead. Not always appropriate. For example, if you give your son to draw or to color, he can do this for hours, or just 5 minutes and then he leaves.
No, he can do more than 5 minutes. He can do it.
Okay, so try at least from. Yes, of course, it's very difficult to assess. Without knowing your son, what exactly has happened, and then he has lost his skills. but from in connection with your initial question, try to use these drawing skills that he has got to the playground. Try to start from something that he knows. That's why I told you to create the list for something that he likes. Take a set of drawing, go to the park. It can be a kind of, from the drawing, you can make a kind of collage. Let's say, come on to pick up some of the leaves and to glue them on a piece of paper. And then during that engagement, you will find a lot of opportunities to socially interact, to talk to your son. Give me this, what is this? And then your son will have more opportunities to talk and to discuss. So always start, instead of starting from an area where he has got apparently more difficulty, start from what he knows, what he likes more, and then try to introduce this into the areas when you see that he has got more difficulties. If you try this, and at least you will see how much you can use this, you can use his current skills.
Actually, I think he's not finding any motivation to do all these things anymore. It is happening for last 2 or 3 months, for about 2 or 3 months.
So not even drawing, nothing at all?
No.
So what does he do at home then? He just sits?
Now I'm trying to engage him in different activities. I am consulting with an OT specialist, and I am doing according to her advice. And I am engaging him in different ADL activities and exercise. I engage him in yoga, exercise, jogging, physical exercise more and more, and this type of works, and engage him in academic works.
Have you seen any, if you see any interest in all of those activities, which are absolutely fine, just try to use them in order to establish the communication. Most of the times is an adult giving instructions, do this, do that, do what I am doing, go here, let's run. And then the child basically doesn't have a lot of opportunities to talk, to discuss, to say something. So try within all of these activities that you are getting from the specialist, which are great, try to grab the opportunities to interact with your son. Not only for him to follow instructions, because this is what it can happen, the response, it can happen, let's say, the majority of the children, but you want to start showing some interest, and that will start from being able to respond back to you.
This is actually very much difficult, because I don't find that how I can motivate him to do all the activities which I am telling you, because but he is very much he can do all the activities, but he is not he is reluctant to do this right now.
Yes, the more, I don't know how long, apparently these activities started quite recently, so you need to make them as fun as possible, so he will have more interest in those activities, and then try from those activities, something will happen. Try to create some sort of difficulties, or even when you do yoga, give me the mat, or do you like that mat? Let's open the mat together. So anything that of course you can do yourself to help your child, try to get your son together to help you. The more that he interacts with you, the better that will be, because at the end it's not the purpose of becoming a yoga professional is about all the benefits that you get, and most than anything is the opportunities for interaction. So anything that you do for your son, not only for these activities, but during every day. Let's say you know about the food, about the drinks. Don't give him everything. Just make him to ask. Approach your son with a glass of water or the juice or anything, just 1 meter away, and then ask him, help him to request this from you. Mommy, can I have this? Mommy, this. don't take the less opportunities, the more he will become silent.
Yeah.
Okay. Okay, thank you.
Thank you so much, Dr. Christos. I mean, we have a very short time today. Before I go to the next question, I just
Yes.
want to ask you, as you said, I mean, that children are different from each other. So certainly
Yes.
problems are individual, right? So the best way to consult with you directly from the parent, give the total history and the behavior, I mean, the analysis or something, and after that you can give the, I mean, your
Yes.
advice. In that
Yes.
case, from Bangladesh or India, I mean, outside UK, how can they or how can we, I mean, get your session, I mean, online session? I mean, that we really need to know, because I got this question from many parents. They want to know, I mean, how they can, access your service online. Are you offering such online services?
Yes, I am offering, yes, in many countries in the world, I am offering
Okay, excellent. Then
services.
what you'll do, I will talk to you later then. I will know the total process, and then I will put it up in our group so our parents can contact with you, after that. I mean, because what you are giving today, we're talking today actually without knowing the child individually, without knowing the complete history. I understand that it's not easy to, I mean, giving the exact advice for that particular. One question from Shoma Devnath. আমি প্রশ্ন করব নাকি আপনি করতে চান প্রশ্নটা? Shoma Devnath, আপনি আনমিউট করেন। জি, আপনি প্রশ্নটা করবেন না আমি ওনাকে জিজ্ঞেস করব?
আপনি করে দিন।
আচ্ছা, thank you. One question from Shoma Devnath, that he has twins and one child, the son is autistic, but the problem is, like, he hits his twin sister without any reason, and just keep hitting him hard. Anything happens to him, or if any problem happens to him, he just comes to his his sister and, like, hits him, and nobody can stop that, and they cannot even keep them together. So they are twins.
Right, because there is not any correlation because there are twins. It can happen, let's say that if it was a sister, let's say a couple of years younger. So only because there are twins, this is not the reason of the problem. Most of the times, I cannot say 100%, Soma, but most of the times it's not a reason. Now, you need to see, again, as I said before, when, for example, that hitting behavior happened, I'm not telling you to try and to see. Let's say if you can recall from all the times that it happened, what exactly you did, what was your behavior, what was the consequence to your son. What you did, you went there, you tried to separate them, possibly did you try to smooth and to calm your daughter, and you provide some sort of negative consequences to your son, saying that no, how many times we have said that this is not appropriate, please stay there, stay on the corner, or I don't know, whatever it's going to be. If I'm just giving you an example, because you need very clearly and to see exactly what it happens when the incident occurs. Now, if in that scenario, it might be the case that instead of your son being able to ask something, a similar behavior, hug me or play with me, or any of the behaviors that you give to his sister, this is one of the ways of asking for this, because of communication, of lack of communication skills. So instead of asking you in a nice way, he does something inappropriate, because that can have a close result. You need to see what more or less what is the reason for doing this. If he does it with other children, if he does it with other, if there are any other siblings, if he does this with older children, with unknown children, unfamiliar children, with you, the parents. Now, if nothing happens and it happens only with the sister, that means that for some reason in the past, that was something that he wanted to happen, And most of the times is the attention that either he gets or his sister gets from the parents. So this is the time when you based on the communication skills and language skills that your son has got, to teach him an alternative way of expressing his need.
Thank you so much. I mean, before I go to next question, I mean, do you have any suggestion? For example, if any parent wants your counseling and wants a session with you, I mean, do you advise us that before I sit for that, session, should I maintain a kind of log or journal? I mean, about the behavior of my child, so I can tell you that his behavior. For example, I want like in your advice on some particular behavioral issues. For example, as already like 5 6 issues we are talking about. So if I want like a counseling from you, should I maintain a kind of journal or like write down that how do you, when, for example, for Shoma Devnath, whether his son and her son like does the same behavior with other children or not, or I mean when he's doing this. So should he write it down and then report to you?
Yes, this is guided by me. I mean, there are specific assessment forms and scales which, based on, typically at the very beginning, I just ask for a very brief description of the behavior. It can be 3-4 lines, nothing more. And based on this, I am trying to provide the parent with the most appropriate screening tool for me to be able to get as much information as possible. So the screening tool, it can be an assessment from 3 pages or up to 15 pages, depending on the behavior. And then the parent will fill in all the details on his or her own time. And then sending this back to me, I will be able to move things forward.
Excellent. So you will start with that. I mean, there is a kind of a particular format that you will use for assessing the behavior. Thank you.
Yes.
So, Farhana Rahman Mithila, do you have any question?
Yes, I have a question.
Yes.
Hi, Farhana.
Thank you, Christos, for a nice session. I want to do a question. My son is diagnosed as ASD, but he is involved in flapping most of the time. As I am a working mother, so I need that. I want that my son will engage in some playful act, that is meaningful act. This is not possible for me to look after him or going with him outside all the time. So I want when I will eat or I will pray my prayer, my son will involve some meaningful act with Legos. Suppose with blocks, I play with him and he builds a block. But when I go outside the room, he starts flapping with these blocks. So how can I help him to some meaningful play and I understand him that this is the material for playing. Thank you.
Yes, Farhana. The answer to this is not easy. When I say it's not easy, what we have said so far is that all of the behaviors, but you have mentioned difficult behaviors. All of the behaviors happen for a specific reason, for a specific function. We call it a reinforcer. Now, with all the stereotypic behaviors, the function, the reason is most of the times inside the person, inside your child. So by doing all the movements with the hands and everything, he gets some sort of satisfaction. Now, in order to replace this inappropriate behavior with something appropriate, we need to match the function. So, for example, to give the same sort of pleasure, the same sort of joy of happiness to the child. However, this is not possible, or at least it's not easy to happen because we are not inside the person. When I say inside, is that when a child moves the hands like this is the sensation of moving the hand, for example, how it feels, how the child looks at his hand, and so on. So we cannot we cannot match this. So what we can do is that to spend as much time as possible to build other skills, other play skills, however, to make those as much enjoyable as possible and to provide as much reinforcer as possible. So the message is this, that you will see, you may not be able to decrease this kind of behaviors to 0%, but you will decrease them as long as you increase other behaviors and constantly you engage into those behaviors, but providing as much reinforcement as possible. So when I said at the very, very beginning, this is difficult because it requires a lot of time from the people, from the parents or from the siblings, to engage, to help the child to engage in more appropriate behaviors. Because any moment, any time that the child is free, I will do the things that I like to do. It's not their choice. When I say it's not their choice, it has been extensively reported in the literature that there are difficulties within the sensory modulation within the brain. So let's say they need whatever they need. When I say whatever, because it's not clear, we cannot assess at that moment, is it the movement, is it the tactile, is it the vision, visual, the satisfaction, is it a combination of everything? So these difficulties exist. However, we can reduce them when we build new skills. And that requires a lot of time.
Okay, thank you, Christos. So I will try to divert this
Yes.
in this another meaningful act. Yeah. Okay, thanks a lot.
You're welcome. Just very briefly to give let's say an illustration of what I'm saying about this, which technically are called the automatic reinforcement. Think of a baby, let's say 6-7 months old. The baby puts toys or plastic or even his fist in the mouth, and then we feel this, that okay, it's natural, it's a baby, and this is what they do. They try to explore their senses and so on, and they do this because they get satisfaction. Gradually, then when they learn more things, they learn how to play, they get the smile and the hugs and the kisses from the parent and other things, and they can put in their mouth eatable things, then this behavior of putting items in their mouth stops. So that sensory need, if we tend to call it like this, finishes. Because there is not, with the children within the spectrum, then it seems that that need, not for all of them, but for some of them, stays there. But this is the only way that we can replace, in exactly the same way as we replace them with neurotypical babies.
Yeah. Thank you so much. I mean, আর কোনো question আছে কারো? কোনো প্রশ্ন থাকলে করতে পারেন। আরো কোনো প্রশ্ন নাই? One question, I mean, Dr. Christos, I mean, regarding the, I mean, contemporary autism or, I mean, NGD management protocol in Bangladesh, what's going on here? I mean, our management protocol, basically we have, I mean, special education, occupational therapy, and speech therapy, basically, right? So ABA is not practiced that much. We have, but not like very common here. Now, some people, I mean, because as I'm representing parents as well, so I know this, but I just want to know from you. I mean, so people hear from you that people have an idea, it's a wrong conception that, how this, for example, if they apply ABA on their children, how they will go together. I mean, are they conflicting? Like, for example, oh, sorry, there's another one, which is kind of biomedicine kind of thing, which is not a therapy. I mean, these are the things that we use in our country. I mean, special education, occupational therapy, speech therapy, I mean, ABA to some extent, and biomedicine. Now, people have some people have an idea that if we start like ABA, should we continue only ABA? Should we stop like, occupational therapy and speech therapy? Is it, are they conflicting or they should grow together?
Right. How things should be. There is not any confliction. The thing, what it makes, what is ABA, and just in a very, very plain way, whatever we do in order, any behavioral modification or any approach that we do, the core is that we collect the data on observable behaviors. So if we say, for example, that yes, there is a change, or my child starts talking more, okay, that is not good enough for us. We need to see, okay, what exactly that means. It means that in the presence of that particular stimulus or item or that person, the child can say 2 or 3 words, whatever the words are. So everything needs to be very, very specific. Now, with the OT, with the speech and language therapy, what the best collaboration that can happen is that when everyone, they follow a behavioral framework. When I say a behavioral framework, from that perspective, to collect the data. If, for example, you are having an OT and you're saying, okay, let's do, I can see that there is a lot of sensory need. And I provide the sensory diet 8 times for the next, I don't know, couple of weeks or whatever it is. Now, if you are not able to demonstrate the benefit of that engagement in all of these sensory activities, then of course it comes in conflict with the ABA, because with the ABA we work in a scientific way of collecting data to see the cause and effect as much as possible. If the OT or the speech and language therapist can see that, okay, through these engagement and exercises, this is the outcome, this is what eventually we manage, then that collaboration is perfect. There is nothing wrong about this. So there is nothing wrong about having here the ABA, the behavioral analysis, here the speech and language therapist, here the OT. What it is important, and I think that this is what it should matter, everyone, and particularly parents, is objectively to be able to see the progress, to be able to see the improvement. If it is very, very vague and very, very general, and most of the times, yes, the child, let's say during doing sensory integration activities, it's fun on the swing and everything, yeah, okay, as a leisure activity is absolutely fine. However, how this engagement will facilitate and help the child into their functional skills.
Okay, thank you so much. I mean, so you mean that they're not conflicting at all. Rather, this collaboration is really important. Like, using all this, like, the techniques or methods, as you said. For example, yesterday I was attending session with a doctor, of biomedicine, and he said in his session, this is from the US. He said that biomedicine works from inside, whereas the therapy works on other side, outside. Like, so they both are important. So this combination is really important, as you say.
Yeah, it's very, if I can give you an example with biomedical approaches, and this is extremely useful. And let's say that you're having a child who can concentrate only for 10 seconds. After 10 seconds, then looks away, or starts doing other things. You have tried from the behavioral perspective a number of interventions. However, you cannot increase this concentration span, let's call it like this. So maximum it can go up to 12 seconds. Now, it comes a biomedical approach, and then may provide a medication to facilitate, as you said, from inside, in order to increase this attention. Now, let's say the child now can concentrate for 1 minute. Now, this 1 minute needs to be, here it comes the behavioral approach in order to make the maximum out of that 1 minute. So the maximum of the benefits from the medication. And we know that not all of the medication can work in exactly the same way for all of the children. Let's say that that will be the positive outcome. Other things, the side effects might be quite adverse. So the behavior analyst and the people work need to inform the physician saying that, okay, this is what it happens. Can we increase the dose? Can we change the medication altogether? But these two need to go hand by hand in order to get the maximum out of the child.
Thank you so much. We'll finish our episode today because also already we have only 5 minutes. At the end, as we asked you before, I mean, we want to know about your the way to access you, like for consultation online. How can I do that?
I have sent you the information. I will revise that information that I sent you, and in case that there is anything more to add, I will do this, and then I will send you via email, and then you can share it with the members of the center.
Thank you very much. Because some parents were asking about it because it's not possible to go, I mean, to UK, of course, right now, and for many it's not possible. So if you like, online consultation, they can ask you, and they can, the children can go, I mean, under your consultation, and especially for behavior modification. Dr. Christos, we are really grateful to you for your time. We know you are a very busy person, and you are, out of your, I mean, very, tight schedule. I mean, you are giving time to us, and we are really grateful to you. And we wish you all the best, and we wish you safe and successful life, of course. And we know that Corona situation is worsening in London, and we are really, I mean, worried, and also in Bangladesh and other places as well. I mean, other waves actually, one after another. So please stay safe and stay with us. And I will share your information, like contact information, with our parents so they can contact you.
Okay, thank you very much, and I wish you and all the parents all the very, very best, and I hope that you will start seeing progress at your children's behavior, and I hope also that this, as you said, pandemic will eventually over sometime soon.
Actually, the best thing with you, frankly speaking, I mean, when you discuss the problem, I mean, when we raise the problem, and when you analyze the problem in such a nice way. I mean, it seems to us that it's not a problem at all. I mean, that's maybe the best way, best part of it. Thank you so much. And
thank you very much.
See you again. Okay.
Thank you very much. Take care, all of you. Bye.